sharing my slides. I'm trying to connect with my computer. But in the meantime, I don't want us to waste a lot of time. We'll just have the discussion. Then if it will be possible to see the slides fine. If not, we'll share the slides. Someone can go and check. So let's just have the focus. But before we do that, let's just have a short prayer. Thank you, Lord Jesus. My prayer and my request this evening is that you will speak through me to your people in Jesus' name. Amen. Now, what is suicidal ideation? So, suicidal ideation comes from suicide. And what is suicide? Is the intent to cause one's own death. Like you have the intention of taking your own life. So suicidal ideation now, there are thoughts that are leading to one taking their own life. So it starts with wanting to die or kill oneself. Suicidal ideation can stem from passive statement like, I wish I wouldn't wake up tomorrow, to I should drink this poison. So it starts from the passive thoughts of wanting to take your own life to now having that intention and taking the methods or the lethal methods for you to take your own life. Now, not all suicidal ideation leads to suicide, but a story is told of one of my acquaintance had a client. This client was a young boy of around 19 years with the pressures of life, with the things going on here and there. This boy had attempted suicide, I think, 4 times. And this boy was now taken to a facility. When I talk about facility, for the purpose of this session, it is a mental health facility. And in a mental health facility, for those who have visited, where someone is having suicidal ideation, they are isolated. And you are isolated in kind of a room with, they are given some plastic spoons, plastic cups, things that they can't use to commit suicide. Now, you see, this boy continued on with life until now the psychiatrist felt, you know what, I think I should now release him to go home because he's back to his senses, he's normal. Little did we know the moment he got home is the moment he committed suicide. So, why am I saying this? Because suicidal ideation, once it gets chronic and once someone has those several attempts, there is an attempt that will lead to suicide. It might be not all suicidal ideation leads to suicide, but the more attempts someone takes, it's the more they will end up dying by suicide. So, what are the global statistics? The global statistics shows that 1 out of 100 deaths in the world today is caused by suicide. And this suicide, according to WHO, is the 3rd leading cause of death among the age of 15 to 40 years. It affects everyone. Whether you fall in that age, it doesn't mean it doesn't affect you, no. It affects all ages, gender, culture, and socio-economic groups. But know this, women have more suicidal ideation, but men complete the process. What I mean is, a lot of men die by suicide, but a lot of women have suicidal ideation. Now, what are the types of suicidal ideation? We just have 3 types. One is the passive. Just like I said, someone having some wishes. I wish I wouldn't wake up tomorrow. I wish I wouldn't do this. I wish, you see. And this is a person who doesn't have any plan, and they doesn't have any lethal means to fit the process. It could be they are having challenges in their lives. It could be life has taken them through a very rough curve, and they are in the rock bottom, and they start wishing death. That is a passive ideation. Then we have an active ideation. Active ideation is where someone now is having both the intent and the means and the plan to commit suicide. A while back in the news, there was this boy who was studying killing. He going to this media, doing all that. You find now for someone with active suicidal ideation, they go to the social media, they are searching ways of dying by suicide. Someone with active suicidal ideation, they are making plans. Then we have chronic ideation. My well good friend and pastor Amenya was speaking about those non-suicidal harmful behaviors. But now, I met this young girl 1 month, 3 months ago, sorry. And she was cutting her wrists. Take caution, parents, please. And the father was called in school, being told, come and see your daughter. When the daughter was asked what's going on, she just said she just felt like she should do it. I met her physically and I asked her. She told me, my parents don't love me anymore. I feel lonely. I eat alone. My mother comes late. My dad comes late. I'm just in a house full of workers, but no one cares about me. All they tell me is, wake up, do your assignment, your teacher is coming, do this, do that, eat, sleep, only that. So this young girl was trying to alleviate the emotional pain by inflicting herself pain. And now the question is, what if she didn't suffer? Be very keen and cautious about these young girls and boys. And even he also mentioned an issue of bullying in school. So you don't feel loved at home. In school, you're feeling like you're not fitting in. The next thing, you're feeling emotionally pained. Then the next, you start doing self-harm behavior. Then the sudden calmness after depression. Sometimes, Godfrey, please. Sometimes you find people ask themselves, but this person was so good, this person was so calm, how come they committed suicide? I can't believe their life was going on so well. There is an emotion, there is a certain calmness that comes after depression. That calmness comes about because this person has already made up the decision. So whatsoever you tell them, it's just like a sponge, it will absorb. But you don't know the decision this individual has made. Now, suicidal ideation in men. Men have higher suicide completion because they are less likely to seek help. A man can be dealing with a lot of trouble. A case that was mentioned to me by my good friend from Zambia, one of their pastors who lived in a toxic marriage for 25 years committed suicide on a pulpit. So men, they are more likely to complete the process because a normal person would like to have an outlet emotionally. And when they don't have that outlet, they are more likely to take actions and feel like I'm not needed anymore. Then they are more likely to use lethal means like rope. Women commit suicide a lot with medicines like pills, but men most of them can jump the floor. Most of them can even stab themselves. Common signs of suicide ideation in men is increased aggression. When someone was just normal, calm, and then they're just irritable, they're just angry. Take note. Then there is substance abuse, that which we call acting out. When the pain is inside, most men try to express it through alcohol, through drinking, through pornography, masturbation, name it. Then there is work-related identity crisis. And this is facing a lot of men because, to be honest, most good things are happening and they are promoting girl child. And I usually ask myself, where is the boy child? Two people are going for an interview, and because one is a woman, for a fact of being a woman, they will be higher than the man. Most men mask their ideation with anger and irritability. So if you want to know something is going wrong, when you suddenly see a man has started drinking alcohol, they didn't drink, or if they did, it was minimal. But now they become chronic drinker. They are angry all the time. They are irritable all the time. Take note. Suicidal ideation in women. Higher rates of suicidal ideation is seen in women because they attempt more frequently. Because of so many factors, like we mentioned, like the hormones, factors like relationships. But the beauty with most women, they are more likely to seek help. You can just have a normal conversation. Like I was having one the day before yesterday with a fellow counselor. We were planning some workshop, and then she asked me, "Are you really, really fine?" You see, women have those conversations where if you feel emotionally burdened, you can let it out. But most men, because of the nature of the stoic society that men must harden up, kuwa ngumu, most men don't seek help. Now, women express emotional distress openly. They don't hide anything. But note, there is changes in appetite and sleep more so seen in women. And then increased worry time, what we call rumination. Then there is also postpartum vulnerability. I'll dwell on this a little bit. I know time is, but I'm almost. Now, when I say postpartum vulnerability, what I'm speaking about, bearing children is a task on its own. And when a woman doesn't get the necessary support, they start, first your body changes. You encounter a lot of hormonal changes. But now the lack of support is what pushes them deeper into postpartum depression. Because you're tired, you're exhausted, your body is in pain, and then you are forced to take care of someone else. And then someone start becoming angry and irritable and isolating. To an extent, they are really hurting. If you know someone who doesn't have support and they just have a small baby, visit them. Have a chat with them. Help them even bathe the baby, feed the baby. Tell them take a rest. Even if it's your wife and you feel the duty of a woman is to take care of their children, for the mental health of this woman, support them. Whether you have been brought up in a family where men don't support women, you can be the exception by supporting your spouse so that they will grow healthily and they will have that relationship with, so that they will grow and have that relationship and bonding with not only the child, but with you also. Pastor Zachary. Now, as I was saying, there are two things that you should note when it comes to brain stress response dysregulation. When the amygdala reacts to something, you will become impulsive. You will take a decision that you haven't rationalized about. But the prefrontal cortex, the work of the prefrontal cortex when it comes to stress issues is to cool down the brain so that it's the rational part of the brain that will allow you to rationalize the situation before the amygdalas reacted. So you find in most suicidal cases, the pressure is high, the emotions are high. What I recommend when the pressure is high and the emotions are high, take a break. Why? Because in the next 90 seconds, that is 1 hour, 1 minute, 30 seconds, your emotions will have cooled down. Even in arguments, when you feel the pressure is going high, walk out. Take some deep breath, come back. Your emotions will have lowered, and the action that you would have taken, you won't take that action anymore. The third factor is the hormonal changes, and this happens more so to women when there are issues to do with menstruation, issues to do with childbirth, issues to do with, you see, women are affected more when it comes to hormonal changes. And you find most women, they have suicidal ideation when they have PMS, premenstrual syndrome. And then we continue to, what are the social and environmental triggers to suicidal ideation? They include things like job loss, divorce, stroke, dysfunctional relationships, bullying for the teens, or even bullying at work. It happens. There's the financial issues, there's the exposure to suicide. And when I'm saying exposure to suicide, be keen what you watch on social media. Be keen what you see on social media. Be keen how much information you expose yourself. Because the more you consumed, by beholding, you become changed. The more you consume something that is involving you taking your own life, your brain will start processing it as a way to alleviate pain. And then you start having those suicidal ideation. Next is suicide attempts. Then the other environmental trigger is the access to lethal means. When I say access to lethal means, there are things like knives, things like pills, things like ropes to hang themselves, and so on and so forth. Symptoms of suicidal ideation. Now this is where the discussion is becoming interesting. How will I know that I am having suicidal ideation? How will I know that my spouse is having suicidal ideation? How will I know that my colleague or my friend? Number one, when you start hearing conversation about death, people start talking a lot about I really want to die. And the one major statement that you should always take in, when someone says they are tired of life, take that statement seriously. Someone just say, I'm tired, nimechoka na maisha. I'm tired of this life. Take that statement with utmost seriousness. Don't leave that person alone until they are able to share what's really in there. For a problem shared is a problem half solved. Expressing hopelessness. When someone has lost hope, they feel, I don't have to go to this work. I don't have to do this. I don't have to do this. They withdraw from friends and family. And by this, I'll share a story. Today you will listen to so many because I've encountered so many in my practice. This young mother was crying. For people who follow the media and mental health issues, the boy had finished Form 4, and this boy didn't get the grades that they expected to get. In short, they had failed. And once the boy, I don't know if it's the pressure of the family, the boy stopped going to have dinner with the family. The boy started withdrawing to himself. She would wake up, shower, call everyone to come, let's take breakfast. The boy will say, I'm okay, mom, I'll eat later. Speaking of such statements, the trend continued, but little did she know the boy was diving deeper and deeper and deeper in suicidal ideation. Until the day this young man hanged himself. The mother just wondered. They were going somewhere. Then the sister came crying. Mom, bro amejinyonga. Be keen with your children when you notice changes. What are these changes? Not only your children, even your colleagues, even your spouse. If this is someone who was so calm, composed, they start talking a lot. And it's not in their nature to talk a lot, take note. But if this is someone who really is sanguine or a choleric, someone who is social, and then they start withdrawing to themselves, they start isolating, take note, because most suicide cases, people change. Change doesn't always have to be withdrawing. Sometimes this is someone who will overwork themselves because the pain is too much. They don't want to deal with the emotion that comes with being lonely. So they have to feel that loneliness with being busy, with working, with alcohol, with substance abuse, with addiction, with reading, whatsoever. You're starting to wonder, why is Jane, I like using Jane, I have an auntie I love so much. Why is Jane doing these things? She's focused, unlike her normal self. She is too. Once you see such incidences, once you notice those changes happening, and the change is happening contrary to the nature and character of someone, those are the moments that you bring them close. You bring them to yourself. You try talk to them more often. You try listen to them more often. It's just sad. The next moment they are happy. Someone acting like they have bipolar, but they don't. Then there is giving away possession. You find this is someone who is saying, oh, I really think this laptop of mine will be a good fit for you. Start asking yourself, this person really loved this laptop. Ask them, where are you going? then try to listen to them more. And then there's actively searching for suicide methods online. If you go to your colleague's desktop or your spouse desktop, and then you are wondering, why are they searching, silent suicide methods? You should really take caution and have that conversation. And if they can't talk to you, get someone closer to them to talk to them. What are the emotional indicators? Persistent sadness. Suicide is closely linked to depression so much because most depression can lead to suicide. Then there is anger and irritability. Now, this happens more so in men than women. Because when most men are depressed, they portray signs of anger. They are so irritable than women. Then there is emotional numbness. When I talk about emotional numbness, this is someone who, even when something good has happened, they're not happy, they're just normal. Something bad has happened, they're not sad, they're just there. Then you wonder, I think most of us even have gone to a burial and someone is grieving and you're wondering, how come this person is not sad? This person is not crying. That is a moment of emotional numbness. Whatsoever you tell them doesn't hurt them anymore because they kind of feel they are making a decision to get rid of the pain. Then there are things like feeling like a burden. Take note, when someone says, I think you could do better without me, take caution of that statement. That is someone who has started to feel, I am a burden to these people. And once you start feeling you're a burden, you will either leave or you will look for ways to get out of the picture. Then there is loss of interest in activities and hobbies. This is someone who used to really enjoy mental health issues. They used to really enjoy singing in church. Then you wonder, this person is not even opening the songbook. What could really happen? Talk to them. Be there for them. Be close to them. There are behavioral indicators like substance abuse, like risk-taking behaviors. A good case I'll give, I once had a client, you see, when people were going to Russia, let me give you a very interesting story. This client of mine was battling with social media addiction. When I mean social media addiction, newsfeed. When the Russia and Ukraine war was very strong then, and then he really had this desire to go to Russia. Not because he could make change, but because he felt my life is falling apart. I don't have time for my children. I don't have time for my wife. I don't do the things I used to enjoy doing. And you see, most risk-taking behaviors come about when you want to run away from pain. When you want to run away from emotional pain or emotional dysregulation. This young man, when he called me, we had time to call someone 11 p.m. at night. If you're a therapist like me, there are times you'll get weird calls at night. And he told me, you need to help me. I'm sinking. Those are the statements most people use. But this person had already decided he wants to be in the battlefront in Russia. Because he can't deal with the pain when he looks at the wife and the children. He can't deal with it. When he sees that I'm not. You see, when someone is addicted to such things, instead of even going to work, they are busy scrolling. They can't sleep, they can't do anything, they are busy scrolling. They need to see what's the next update, what's really going on, what's this. You can't really focus even in simple, small activities like brushing your teeth. It was that bad. Now, normal or all cases of suicidal ideation, the reason why people take those risk-taking behaviors, as I said, is running away from emotional pain. The best way we can do that is try to alleviate the emotional pain. After a few sessions, he went back to normal. Right now he's treating cows wherever because he was a vet. So, there is also sleeping or too little. When you find you just feel like sleeping a lot, or you find your mind is ruminating. When I speak about ruminating, for those who are not aware of the term, I mean your mind is busy worrying about things. You're busy worrying. Now, there is also self-harm behavior. And these, I am going to speak these more so to the parents, because the self-harm behaviors happens more so with teens. Someone who has, they are persistent and they are chronic. Just like the case I gave of the young boy, that is someone who has suicidal ideation for a long time. And when is it named persistent? When it goes for more than 6 months. Now, in psychology and in treatment and in mental health, for something to be called a disorder, it has to be affecting your personal, it has to be affecting your mental, it has to be affecting your relationship, your occupational. For suicide, for it to be called a chronic case, it has to be affecting you the bigger part of the day for more than 6 months. What are the causes of suicidal ideation? Now, it doesn't have really one major cause that we can say, but mental disorders are a trigger or a factor in suicidal ideation. Mental disorders like depression, bipolar, anxiety, and things like substance abuse, things like traumas, and also chronic illnesses. I like talking, giving stories. This man had a family, and he liked sports so much. And when he liked sports so much, one day he got into an accident. And you see, some accidents make you become paralyzed. You can't walk again, you become disabled. And this man, because of that accident, he started feeling, I am not good enough. I'm not supposed to live. Yes, he committed suicide because of that short accident that happened. And for him picturing, I have to live with this condition for so long, it didn't help him. People tried to help him. People tried left, right, corner to really help him. But at the end of the day, he committed suicide. It's very sad. Another major cause of suicidal ideation is when people have financial issues like job loss. Like you don't know where you will get your next meal from. Like you don't know whether the landlord will decide you're sleeping outside today. Like relationship issue. Sorry, someone is interrupting the session. Relationship issues, things like divorce, things like dysfunction of families. Could someone mute the person who is speaking kindly?
Then Helen, please mute yourself, Helen Barno. Thank you. Please, those whose microphone is on, kindly unmute. Kindly mute, sorry. Request those whose microphone is on to unmute. Helen Barno, thank you.
Okay, thank you, Sister Lois. Now, what are the psychological risk factors? Things like hopelessness, things like feeling worthless, things like shame and guilt. And I'll talk about shame and guilt. It doesn't matter what your past is. It doesn't matter you did something. It doesn't really matter. What I want you to know today is there is life after that incident. There is life after whatsoever happened. It shouldn't eat you up. It shouldn't make you feel less of a human being. And I'm connecting this with, see, in the Bible, God calls us and tells us, cast all our burdens to Him, for He cares for us. Whatsoever that shame you're feeling, that is making you feel worthless, that is making you feel, I don't have hope for tomorrow, cast it to God today. Tell Him, God, this situation has been eating me up. Enough is enough. I want a clean start. There are things like social isolation. Most people with suicidal ideation see people around them that they don't understand what they are going through. It's true. People around you don't understand the situation. They don't understand what's going on in your mind. They don't understand the struggles you're going on. But all I can say is, by sharing, you will get help. The reason I'm saying this, yesterday I had a very important meeting, and this lady told me if I hadn't shared, I wouldn't be feeling...
Bruce Amoy and Munira, please mute your microphones, please. Thank you. Sorry for...
Okay, thank you, Sister Lois. Now, he mentioned a problem half shared is a problem half solved. And this is not someone who is saying it for motivational purposes. It's someone who was going through a tough situation. So if you feel that this thing is eating you up and no one will understand, your family, you may not talk to them, but talk to someone, whether a stranger, whoever it is, because it makes you feel that you want to stay in isolation. And the more you're staying in isolation, the more it's eating your mind, the more it's making you feel, I'm worthless, I'm hopeless, there is no future for me. Then suicidal ideation has impulsivity. Impulsivity is when someone was just thinking, maybe something is not going on well. Then the next moment you see they have taken pills. The next moment you see they have hanged themselves. Past suicide attempts is the strongest predictor of suicide, deaths by suicide cases. What are the biological and neurological factors? We have issues to do with genetic predisposition. I'll say this with a story. When I say genetic predisposition, I'm not really clearing it 100% that if your father committed suicide, you will commit suicide. No, but you are more likely to commit suicide because there is something we called acquired characteristics. Acquired characteristics, this is something that if you saw something happen, and this is from your family, like a little boy, if they saw an abuse from their father to their mother, this little boy may translate this to be the new normal. So if someone who has had suicide cases in their family, they are more prone to suicidal ideation. Then there's brain stress response dysregulation. When I say brain stress response, there's the prefrontal cortex that is for regulating the stress levels, and there's the amygdala that is for reacting. Like something bad has happened, your amygdala is telling you to do this. I should take this pill. But the prefrontal cortex should be the one to come in and regulate. But you see now, sorry, I'm being interrupted, but there's something we call self-esteem. Once the body has changed, they start seeing themselves. They have, most of them are prone to low self-esteem because they start wondering, why am I having this weird body, feeling these weird feelings? So for the women, support them. Suicidal ideation in teens. These start with peer influence, academic pressure. And when I say academic pressure, parents, your child can be a better person without getting A's. What is most important is they grow up a well-rounded human being. If you don't believe me, just the other week, a young boy of the University of Nairobi Pharmacy hanged themselves because of the pressure they are getting from their parents. You will pray and wish that they were there, but they won't. All you can do is give them the necessary support, the necessary love, the necessary nurturance. Now, this social media comparison, where these young teens feel so and so is doing better than me, I'm not good enough. Those are the times that you encourage them, that you encourage their uniqueness. There is bullying, whether in person or online. There is the common signs. There is drastic mood swings among the teenagers. There is academic decline. There is self-harm marks. When your child comes home and you're seeing they are having marks all over, start to question what's really going on. Either in school, they could be either facing bullying or they are doing self-harm. Then there is isolation from friends and family. There is talking about being better off gone. When you hear that from your child, that is the moment you drop everything and you tell them, Mom, let's go out, Daddy, let's go eat something out and let's have a conversation. This meeting can wait. When I said isolation from family and friends, a mother told me, I don't see my child playing outside with other children. And when we went to analyze the situation better, we realized this young boy was being bullied. Just don't assume. If you will have time to go back and even check this session, please do. Read through the slides. Watch the signs. Be careful. Now, what are the high-risk situations where someone has, one, a specific, before they are intoxicated. Number 5, they have experienced a major loss. Now we are going to the most interesting part, which is how now do you have a conversation with someone with suicidal ideation? Ask directly, are you thinking of hurting yourself? Don't be judgmental, please be empathetic. Don't tell them you are better off gone. Don't push them to commit suicide. Just ask them. When someone talks about, I'm tired with life, ask them, why do you say so? Are you feeling like hurting yourself? And even if they don't open up there and then, just give them a disclaimer. I'm here to listen in case you need me. That is something I took time to master as a therapist, because there are times I go into session and we just stare at each other. Someone tells you, I don't know where to start. Just tell them, just sit down, allow yourself, process your emotions, cry if you have to. Yeah. So just give them that disclaimer. I'm here if you need someone to talk to. Listen without judging or giving unsolicited advice. That moment, what that person needs is an empathetic listening ear, not someone who is, oh, you know what, your life is doing better. You may see they are doing better, but you don't know what this person is going through. You don't know what's eating them. Avoid minimizing their feelings. Oh, get over it. You can get over it. No. Suicidal ideation is not something to get over. It's something people process. It's something people heal from. And it takes time and effort and support. Stay calm. Don't judge. Most of the times we are more like showing those pity parties. No, they are not needed. And don't ever say get over it. It's also not needed. What not to do? Do not say it's selfish to commit suicide. Because you're not in that person's brain, you're not in that person's mind. Do not argue logically against their feelings. Trying to rationalize their feelings will hurt them deeper. What they need is you trying to step into their emotional shoes. Being in those emotional shoes, do not promise secrecy when it comes to suicide cases. Because even in our ethics of practice, one can break confidentiality when another person is contemplating harming themselves. Do not leave high-risk individuals alone. That's the moment you drop everything and you tell them, I'm here for support. Prepare a meal for them. Give them water to drink. Watch a movie together. Do something together. But don't ever leave someone who is contemplating having a plan and having the means to commit suicide alone. They will more likely do it. Do not dismiss warning signs. What are the prevention and protective measures? A strong social support. Access to mental health care. And I'm glad today when I shared with some groups, some people said I must attend because I'm having these ideations. There's also the religious and spiritual beliefs. I had some people out here. Coping skills, and then there's a sense of purpose. Because if you have a sense of who am I, the book of Jeremiah, God said, before I formed you, I knew you, and I gave you a purpose. For I know the plans I have for you, the plans for prosperity and not disaster. If today you're feeling you don't have a purpose in your life, go to the Creator. He has a purpose for each and every one of us. Me speaking, there are moments I hit rock bottom. When I'll be free to share my story openly, I will. But I came out of that pit. And I know each and every one of us can come. Reduce the access to lethal means. And as I conclude, suicide is not a character flaw. It's a cry for help. When someone speaks about wanting to die, they're not being weak or traumatic, overwhelmed by pain that feels unbearable at the moment. Judgment and blame silence people, and the silence increases the risk. What saves lives is compassion, listening without criticism, taking their words seriously, and reminding them they are not abandoned. If someone opens up, respond with empathy. And if you're struggling, know this: you're not broken, you are not alone. And seeking help is not a weakness, it is a strength. Thank you, Pastor Amenya. I'll now give the floor to you so that we can now.
Yeah, thank you very much, our sister and psychologist experienced in this area, and especially I want just all of us to know that psychologist Nkatha has even a page. She does a lot of writing, and you can interact with her, not directly, but also in her website. In fact, that's how I got to read some of her materials, which are very, very impactful psychologically. She has done quite a number of write-ups on women, on men, on adolescents, on all those topics. I do interact with them. I know that, Caroline, you may not know that, but I read widely those materials, and I think I am one of those who like reading these materials that actually handle various areas of especially young people, and also, in fact, the human beings, all of us. So thank you very much for the presentation. We are going to engage on this very topic. Maybe we have 2-3 questions we discuss, and then we will call it a day. Otherwise, thank you very much. Who is going first for question? Please, if we can raise up our hands and we ask this question. We have many other, I have seen another psychologist who is my friend from Zambia, Pastor Darius. Is my friend. He's in fact is my classmate. Let me say so. So we can ask question. Let us interact on this, because this is a matter on the table. It is affecting everybody, everywhere. And usually, sometimes it finds us, like when we hear that somebody has committed suicide, we are like, alikosa nini? Tunaona is well off. Huyu hakuwa anastahili kukufa, like that. But we really don't know how they are pressed. And that's why, as psychologists, we come in to care for our mental health, our emotional, check on our emotional intelligence, because these are the contributing factors. So, who is going first? We are in a question, answer session. Somebody is going first. Any question? Questions? Am I audible? Hello? Hello, am I audible?
The entire team.
Yes, hi.
Hello, Beverly.
Hi, Nkata. So, well, this is it. First and foremost, thank you so much for sharing so vulnerably. I mean, the conversations around suicide ideation require a lot of courage and compassion. So the more we speak about it responsibly, I know the more we'll be creating more spaces for hope, support, and healing. So, well, do I have a question? Yes, I do. I wanted to understand one thing, that what's actually one thing that we normally, like, we often get wrong when talking about this suicide ideation. What exactly do we get wrong when we talk about suicide ideation? And also, I have noticed in workplaces, I mean, you cannot be a whole shoulder to lean on all the time. And so at plus, let me just give this case scenario. I get somebody who, like, speaks out so vulnerably, like, you clearly, he or she feels that I'm using he or she feels, because I really, but I'm not giving out any names, so let me just stop with the he. Yes, so he feels like, well, I've had this thing that has been stressing me out. And the only time he can actually call is around very late hours, threatening to actually unalive himself. And so most of the time you get, like, threatened. You feel, I feel like a little bit shaken, because I feel like if I don't pick his call, I might end up losing him. And I don't want to have that mentality. How can I actually create that boundary? Like, yeah, so that I don't feel like I'm the only person actually he can reach out to. Because I mean, I also need to be sleeping I'm supposed to be sleeping, enjoying my good 7 to 8 hours, not just waiting that, okay, let me just put my phone on, let me remove my phone on DND or do not disturb mode, for fear of being for fear of missing a call from person X. Yes. So how can I be helped as a caring human being?
Thank you, Beverly. But I think as a caring human being, I've been called weird hours, even 12. And okay, for suicide cases, I don't know. For me, even if you call me at 12, I won't be sleeping. When I hear that, it's not like being shaken, really, but rather it's because of the urgency of the matter. And that's why I don't put my phone on DND ever. Because I know one simple mishap, maybe someone had hope, like, Beverly will help me here. If I reach out, they will help me. And then their last hope is not picking their call. And then they start telling their mind, I'm not good enough. I'm better off gone. Now, your first question, I really think as a mental health practitioner, Beverly, let's just give it some courtesy and some understanding that these cases desire our utmost alertness when it comes to them. Because once that person has realized, I really need to reach out, and the only person they can reach out to is you, and now the person they are reaching out to is not picking up. I'll give a simple illustration by a friend who called me from India. They were at the verge of committing suicide. What time? 2 a.m. So all I'm saying is, in our practice, those cases will be there. But will they be there Monday to Monday? No. you may realize it's a case that you're getting once in a week, once in a while, once in a month. That is not something that should really hurt you so much, if I may say. But now the first question you had asked, what do we really miss when discussing about suicidal ideation? Most people assume that when someone is wishing to die, they will just get over it. And you see, sometimes even in our African setup, when someone starts threatening people, oh, I'm going to kill myself, oh, I'm going to kill myself, people start saying, they will just say and keep quiet and sleep and wake up. That can be a case for some people, but that's not a case for all people. And more so men, they don't threaten committing suicide. They just commit suicide. I think that's my take on that. I'll allow other professionals to just chip in.
Deal with it my own way. Have to deal with it. And you know, the meds that I swallowed were actually psychiatric meds. I fear tablets, but that day I actually swallowed over 30 tablets, different types. I was like swallowing like 5 at once. I would get like 5, I swallow, I get like 8, I swallow, I get like 10, like that until they were finished. And after swallowing them, I remember I lay in my bed, covered my head, and you know, I laid straight like a dead person, and I was like, this is done. Let me just wait for the moment to happen. And when I slept, like somewhere in my sleep, I felt like one of my sides, I don't remember if it was the left or the right, but it was kind of paralyzed. I could not like lift it or feel it or something like that. And later on, you know, I told myself, okay, I'm going to die in phases. So this is phase number 1. I have to wait for the next phase so that maybe I can completely get away from all this. But one thing that I did not really understand was the trigger. Up to now, I do not know what made me do that. I do not know what prompted the trigger. I do not know why I did what I did, and I actually cannot explain it. So, and I heard you talk about lots of, you gave lots of explanations about what causes the ideations, and apparently I was waiting maybe for one that connects with me, but I could not literally find it. So, in that case, I have opened up obviously to lead to so many of you. I don't know who you are, but I do not know how I can be helped so that it does not happen the next time, because I was scared after, when I go, like I said, I slept for more than 50 hours unknowingly. I did not know that, because I remember I swallowed those tabs on a Sunday and I did not experience Monday. I came back to life, I think, somewhere at the end of the Tuesday. So I literally do not know what transpired in some hours of my life. And I don't know if it's going to happen again. And if it happens, I don't know how I'm going to go about it. And I'm literally like so lost, because if I knew the cause, I would have dealt with it. But I do not know the cause. I do not know what the prompt. I do not know nothing about it. And I was certain scared. So if I may, what can you say to me, or how can I be helped?
Okay, thank you, Claire. There is something I mentioned called rumination. Rumination is basically when you find yourself you're worried. And something you should note, Claire, is suicidal ideation as something called impulsivity. You're spontaneous, if I may say. Now, back to rumination. Rumination is when you're constantly worried, but you cannot pinpoint the worry until you start taking caution. Like, what do I mean by that? Until you start thinking and starting to analyze, where is my mind taking me? Now, you may be seated and your mind is clogged with a lot of thoughts. Until you start analyzing one thought after another, that's where you will come to understand the pattern. Now, how do you get to understand the pattern? Have a piece of pen and paper. This has worked magic on my life. When I find myself worried and just having that rumination of numerous things that you can't pinpoint what is really making me overwhelmed or what is really making me take this decision that I'm taking. Number one, jot down whatsoever thought that comes to your mind, whether it's financial, you just jot down financial, just jot down another one, children, another one. If you do this process for like a week, you will have one constant. When I say a constant, I mean one thing will be common in all the things that you're ruminating about. Once you understand that one thing that is common is when now you come to understand the pattern. But the other recommendation, I would say, work with a therapist. They will help you analyze the situation deeper.
Yeah, thank you very much. I want to believe that that response and especially the testimony that has been shared, indeed, it may not be the answer that she's looking for, but it's a response that serves all of us. I'm kindly requesting, because of time, this is for those who are attending for the first time, this is how our workshop is running. There is a lot we can learn, and information is power, especially when it comes to mental health. And for those who are in Life and Reason group for our department, we are going to share, I know she's going to share with me all the presentations, and also we've done the audios. We also share the audios, and so I have the audios. I'll be sharing them tomorrow. Kindly let us be part of this. It's a journey that we actually, you can learn and also help somebody somewhere, because that is all about your mental health. Get this information, let it help you, and if you are good enough, then it can, probably God may use you to help somebody else. It is not by accident that you are listening to this workshop and all these presentations. Allow me make this announcement so that I can invite Lois to come and give a word of thanks. Our next meeting is on Thursday, and we'll be having Dr. Lucy to speak to us.